How is respiratory effort measured and analyzed in polysomnography? Have you ever wondered how doctors measure your breathing while you sleep? Understanding respiratory effort is vital in diagnosing sleep apnea and similar conditions. Let's break it down in a simple way. Respiratory effort is the physical work your body does to breathe. It mainly involves your diaphragm and chest muscles. During sleep, any changes in this effort can signal issues like airway blockage or problems with your nervous system affecting breathing. One common method to measure respiratory effort is through respiratory inductance plethysmography belts. These elastic bands are placed around your chest and abdomen. They track how your body expands and contracts while breathing. The data from these belts show how hard you are working to breathe, making them a standard tool in sleep studies. Another method is esophageal manometry. This technique involves inserting a thin tube with a pressure sensor into your esophagus. It measures changes in pressure inside your chest while you breathe. This method can help distinguish between obstructive apneas, where you try to breathe but cannot, and central apneas, where there is no effort to breathe at all. While this method is very accurate, it is invasive and not commonly used in routine tests. Surface electromyography is another approach, where electrodes are placed on your chest to monitor the electrical activity of your breathing muscles. This method is mostly used in research rather than clinical settings due to its limited validation. Emerging techniques like nasal pressure sensors and pulse transit time are also being looked at. These methods aim to provide less invasive options for assessing respiratory effort and airway resistance. When analyzing the data from these measurements during a sleep study, doctors look for specific patterns. For instance, obstructive apneas occur when there is continued effort to breathe, but no airflow. In contrast, central apneas show no effort or airflow at all. Hypopneas are partial reductions in airflow with changes in effort. There are also instances called respiratory effort-related arousals, where increased effort leads to brief awakenings without full apneas or hypopneas. Understanding these patterns helps doctors assess the severity of sleep-disordered breathing. For example, the pressure changes noted during esophageal manometry can reveal specific issues like upper airway resistance syndrome, which may not be visible through airflow measurements alone. Accurate measurement of respiratory effort is essential for diagnosing the type of sleep apnea and guiding treatment options. It also plays a role in evaluating the effectiveness of therapies like continuous positive airway pressure. This measurement can even help identify subtle breathing issues that might lead to daytime sleepiness, even if clear apneas are not present. In summary, respiratory effort is primarily measured using chest and abdominal belts in most clinical settings, while esophageal manometry is reserved for special cases. Analyzing these signals allows healthcare providers to differentiate between obstructive and central events, ensuring a thorough assessment of your sleep health.